متاحة PDF على الموقع أيضا. لا، المحاضرة ما انتهتش، احنا لسه هنبدأ، بس احنا بنتعرف على بعض قبل ما المحاضرة تبدأ. إن شاء الله هنبدأ الساعة 10 بالظبط بتوقيت السعودية. احنا لسه ما بدأناش.
دكتورة منى، الصوت واضح صح؟ أنا بس حبيت أجرب الصوت.
اه، الصوت واضح تمام.
تمام.
الله وبركاته. عملاء كواليتي ليدرز اكاديمي في كل مكان، اهلا وسهلا بحضراتكم في فعاليات ايفنت جديد بعنوان مقدمه في معايير سباهي للمختبرات. هذا اللقاء هو خطوتك الاولى والمهمه لتهيئه مختبرك، حيث سنركز على كيفيه التحضير واداره زياره التقييم بنجاح، فهم متطلبات السلامه الاساسيه essential safety requirements والمعايير الوطنيه، الانشطه السته الحاسمه التي يركز عليها المقيمون داخل المختبرات. يسعدنا ويشرفنا ان يكون معنا اليوم الأستاذة غوى النجار، أخصائية جودة في مركز التميز لزراعة الأعضاء بمستشفى الملك فيصل التخصصي، تحمل درجتي الماجستير والبكالوريوس في تكنولوجيا المختبرات الطبية من الجامعة الأمريكية في بيروت. خبرة واسعة تمتد لأكثر من 20 عاما في مجال جودة الرعاية الصحية وإدارة المخاطر، سيرتيفايد CBHQ ولين 6 سيجما، بالإضافة إلى البورد الأمريكي في المختبرات الطبية ESCB. تحمل زمالة الجمعية الدولية لجودة الرعاية الصحية والمعهد الأمريكي لجودة الرعاية الصحية، خبرة متمرسة في التحسين الجذري للعمليات ومبادرات المنظمات عالية الموثوقية. أهلا بحضرتك أستاذة غوى، نورتينا في كواليتي
آه،
ليدرز
أهلا.
أكاديمي.
شكرا دكتورة منى على المقدمة، وشكرا للحضور. و I can see يعني 35 participants so far, so I'm so glad to be with you for this introductory session.
أكيد الموضوع انترستد، يعني في ناس كتير انترستد بيه، فإن شاء الله يحققوا أقصى استفادة بإذن الله النهاردة مع حضرتك.
إن شاء الله إن شاء الله. So shall we start?
اتفضلي.
شكرا. أول شيء بحب رحب بالجميع، وشكرا لحضوركم، وشهر مبارك لكل الصايمين، وينعاد عليكم بالصحة والعافية يا رب. وبتمنى أنه تستمتعوا بهالمحاضرة اللي مدتها ساعة. The session will be an interactive session, mostly in English. If you have any question, please feel free to raise your hand or to put anything or any comment in the chat box. الإخوة بال Quality Leaders Academy, they will help me in following the chat, what's written in the chat. وبسم الله الرحمن الرحيم. إن شاء الله we'll start. Again, it's an interactive session. Feel free to ask any question during the session. So today's session will be just a brief introduction about the CBAHI Foundation, how it started, and what's CBAHI, what does it mean, why it's important, how the standards of CBAHI have been developed. Also, it's just an eye-opener to the CBAHI laboratory standards and their relevant measurable elements. Also, it gives you or it opens your appetite to attend the 2 days laboratory course that will be held, inshallah, in May 2026. So as a start for the foundation of CBAHI, it started in 2001 and started to be localized only in the Mecca region as Mecca Region Quality Program, MRQP. This initiative aimed to improve quality of healthcare delivery in the Mecca region of Saudi Arabia. And then it expanded in 2005 and 2006. They become officially the national standards they developed, and they are applied within all the nations of Saudi Arabia. And then it gets accredited by the ISQA, International Society of Quality, in 2012. And in 2013, CBAHI becomes the accreditation that is mandatory to all hospitals within the kingdom. So what is CBAHI? It's the official agency authorized to grant accreditation certificates to all governmental and private healthcare facilities operating today in Saudi Arabia. So trying to, why it's not moving, trying to click. Okay, so CBAHI is part of other important also institutions that are under the Saudi Health Council. We have the Ministry of Health, we have the Saudi Food and Drug Authority, and we have the CBAHI. Also, we do have the Saudi Commission for Health Specialties, and we have the Council of Cooperative Health Insurance. They all under the Saudi Health Council. Many of you maybe have the interest to know how the standards of CBAHI were developed and from where it comes, the idea of having all these standards. So these standards, they are set by locally and international scientific societies. They're also based on scientific literature review and research studies. And of course, they follow the relevant laws, which are the laws of Saudi Arabia's, the rules and the regulations. That's why when it comes to the accreditation, CBAHI are more stringent than JCI because they know the laws and the national laws and rules of the countries. So they're more stringent than JCI or any other accreditation. Also, they issued from national and international emerging issues related to patient safety. Like we have the ESR that are similar to the international patient safety goals in JCI. And also they came also as an input from healthcare professionals, providers, and patients. Those standards, the National Hospital Standards, includes 23 chapters around key service provided by general hospitals, going up from leadership, human resources, management of information, and so on until the facility management and safety. And those standards have been developed in 2016, and they are now implemented so far. Very soon, those standards are going to be revised and reviewed. The specialties include 7 specialties that are under leadership surveyor. They assess 489 elements to be scored from leadership until facility management and safety. Also, we do have another specialty, which is the medical surveyor or the medical specialty they have 645 scorable elements. Nursing surveyor or the nursing specialties, they also score 494 elements, and they are listed in front of you. Also, we do have the medication management surveyor, the pharmacy, which they have 422 elements to be scored. Infection control specialty, they do have 499 elements to be scored. And the laboratory surveyor, we do have 654 elements to be scored. And you can notice that we are among the highest scorable elements among all the other specialties. The facility management specialty, they do have 494 elements to be scored. Now coming to the ESR, which are the essential safety requirements, they're equivalent to the international patient safety goals in JCI. We do have 20 standards. 14 of them are under clinical standards, and 6 of them are under the facility and safety standards. So they do have 113 substandard scorable elements because, of course, as you know, when we score a standard, we don't score the standard itself. We score the substandards or what's called the measurable elements. And all the facilities, they must be in satisfactory compliance to all those ESR in order to be accredited. The laboratory surveyor, when it comes to the ESR, they will assess the lab compliance against 36 survey activity. When we say survey activity is under staff interview, is under observation, is under also the document evidence, the closed medical record review. So we're gonna talk about them. So we do have 36 activity. And we do have 2 ESR standards that are under the lab, equivalent to 27 scorable measurable elements. We have the PC25, handling and administration of blood products, and we do have the Lab 51, which is under the infectious disease testing. Also, the lab surveyor will participate in the evaluation of other chapters or standards, 3 ESR standards, which is equivalent to 9 scorable elements that falls under the human resource 0.5, HR 0.5, staff credentials, quality management, QM 17, patient identification, and the facility management and safety, which are FMS 24 for the fire safety. When it comes to the composition of the team that will come and visit the hospitals, there are 7 surveyors. Sometimes we do have additional members like observers or CBAHI that are CBAHI surveyor that is under observation. And they include these 7 specialties: leadership, medication management, medicine, infection control, facility management, laboratory, and nursing. The activity that they are going to go through, they are the document review. They start by document review, which are the policies. And this is a very important step in the beginning of any survey, because anything that has no policy, all the other relevant activities under the document review will be scored as 0 if there is no met for those document review. Also, we do have the document evidence. Any evidence that really ensure, or a proof of evidence ensures the implementation of the policies. Observation, if it's what's written in the policy is being observed in the correct way. Same applies for the staff interview if they are knowledgeable about the implementation of those policies and standards. Closed medical record review, this will be based on some selected charts that the surveyor will indicate during the visit of the units in the lab or during the document review. They will indicate some charts to be reviewed under the blood utilization, under the blood administration, or under the pathology in order to assess some standards, and personnel file to ensure the qualification of the staff that are working in the lab or in the hospital. Also, the hospitals will go through the self-assessment that's usually done before any initial accreditation. It's given a time frame before the initial accreditation. And when the hospital get accredited, there will be a gap of 3 years for the second accreditation. So during that, in order to maintain the accreditation, they have to go also through the self-assessment activity that should be done by the hospital itself before the visit of the CBAHI. Some changes now have been implemented in the process of the CBAHI survey. We do have before a 3 days visit. Now it's back to the corona pandemic of the implementation of the 1 day.
روح
If you can,
أخرتها
دكتورة غوى، استأذنك تفتحي المايك. اتفضلي افتحي المايك.
okay.
تمام.
Was it for too long or only just now?
لا تمام، هو بس كان في حد فتح المايك فأنا عملت ميوت أول، فحضرتك
okay.
اتفضلي كملي. تمام.
Okay, thank you. So now it's back to 1 day visit, which will be like a shuffling of 30% of the standards haphazardly selected, but ensuring that all ESR standards, the 20 ESR standards, will be selected among those 30%. The same thing will be uploaded on the offsite documents. And there will be notification to the hospital 5 days prior to the visit. And also there will be 7 specialty surveyors that will perform the survey assessment. The activity during the survey visit, they will include many activities, but 59% are given to the unit visits, where they visit the lab sections. They will visit also some of the units, emergency, sometimes OR, ICU, surgical wards. It depends on the surveyor himself. Also, 21% of the activity will be spent on the document review, which are the policies, deep review of the policies of the hospitals to ensure the compliance to those policies later on during the visits to other areas in the hospital. 10% of the activities is spent on the personnel file review, as I said, to ensure the qualification of the staff. Also, 5% will be spent on the closed medical record review in order to also review some of the administration of blood if it's done by the normal and usual standards. Also, 5% will be spent on formal and committees interview. The general documents that needs to be available during the area's visit, and this applies also to the lab. So mostly when visiting all these areas and the lab especially, the surveyor will go over the organizational chart, and also it's very important to see the lab organization chart, the scope of service of the lab, if it's available in all the units, and also whenever it's needed, department chairman, director, CV, departmental staffing plan, department minutes of meeting, especially when it comes to the committee for the pathology committee and the blood utilization committee. So they are assessed based on the frequency of meetings, and they would like to see the minutes if they are discussing all the charges included in the CFO or the terms of reference of the pathology meeting or the tissue committee meeting and the blood utilization committee. Also, the on-call list of internal and external customers. Who are your customers? In the lab, for example, it's very important to identify those, and it has to be mentioned in the scope of service. We're going also into too much details about it when it comes to the 2 days workshop or course about the lab. Examples of departmental relevant policies, example of requests for resources by areas, leaders, some quality indicators that are important, especially for the lab when it comes to the blood and how to monitor the blood utilization, the CT ratio, some quality projects, and the surveyor will be so keen to interview some of the staff about the ongoing projects that are implemented within the lab, and if they do have some knowledge about them, if they are part of it or not, and a training record for new instruments if applicable, especially when it comes to the installation of new equipment in the lab. Tracking records, when also the survey started, the initial accreditation, usually the tracking record is over the last 4 months only. They do not exceed more than a 4 months review of records if this is an initial accreditation, or let's say the first accreditation. Then if they got accredited, hopefully they will be re-accredited, and the window for the tracking of the records is almost 12 months. It's not almost, it should be 12 months back. When it comes to the scoring, we do have 0, 1, or 2. So the 0, if they do have, or the surveyor noticed a compliance of less than 50%, so they do score 0. For example, if doing the chart review for some of the charts, if they requested 5 charts and only less than 50% of those charts meet the standards, so they will be scored as 0 because they did not meet it. Or they will be scored as 1 if the compliance is between 50 to 80%, or 2 if the compliance is more than 80%. Sometimes the lab is having some services that are outside the scope of the lab. That's why they are scored for not applicable. For example, if they do have some outsourced, so it's not applicable for them. If they do not have a donor center, for example, they got the blood units from a regional blood bank, so they will be scored as not applicable for all the standards under the donor center. And the track record period, also shorter than the required, will reduce the score proportionally. Also, if the standard requires some policies or plan and it's not approved, or it does not exist, or it was not provided at the time of the survey, the other relevant activities will be scored as 0. That's why the document review is very important at the beginning in order to assess all other relevant activities. If the standard requires policy and plan, and if it's approved, but there is no evidence of implementation, maybe they just put the policy, they took it from somewhere else, and the policy and all other relevant activities also will be scored as 0. When it comes to some services that are outsourced, we do have conditions for this. There should be provided a service contract or agreement, written agreement, or a memo of understanding, MOU, as articulated in the leadership LD 21, specifying first the scope of service and the validity of the agreement. So what are the lab tests that are included in these service level agreement? Also, for how long is the agreement? For 1 year? Is it renewable? And some agreements, they must have conditions, including the accreditation status and or accreditation standards. Is the lab providing that outsourced services? Is the lab accredited? And they do have to provide their certificate of accreditation. Also, they do have the right, the hospital, when doing this agreement with the other regional lab, they must have a review or an audit to be conducted at a regular or a certain period of time to be to be conducted by the hospital itself, so that they ensure that the all the other they go with the agreements written in the agreement paper. There is documented evidence of regular contract review and or audit. So they do have to review this agreement every year, or renewable by itself, or when it will be, if there is any dispute, how to resolve this dispute. All of these, they have to be mentioned in the service level of agreement. If all of the above conditions are met and all of the technical standards related to the outsourced services, the relevant standards or substandards will be scored as not applicable, because they're not doing the service itself, it's outsourced. So it will be scored as not applicable for them. However, if there is no service contract agreement and no evidence or documented evidence of regular audits, and the outsourced services still performed outside the facility, all the relevant standards or related substandards will be scored as not met. Okay, even if they are outsourced, but the level of service level of agreement is not satisfactory, all relevant substandards will be scored as not met. But if there is no agreement and no documented evidence of regular audits, and the outsources services performed inside the facility itself, so all the technical standards related to the outsourced services should be surveyed as usual and scored accordingly, yani normally. Any questions so far? Okay. So the lab surveyor itself, the activities, all the areas that will be visited, they include the lab sections: chemistry, hematology, serology, microbiology, specimen collection. Sometimes they do tracking from specimen collection until they receive the lab, cytology, anatomic pathology, blood bank and transfusion lab, and randomly selected units or clinics like wards, emergency, OR, etc. The activities that are done are the closed medical record review, leaders interview, document evidence, staff interview, and observations. And this is in addition to the document review, which is the main the most important activity, because based on it, it will be, the other activities will be assessed. The famous question that's usually asked by a surveyor when they visited the lab or when they interview the staff is the definition of the turnaround time, TAT or TAT. Many staff sometimes they are a little bit anxious and they not familiar maybe how we call it, either turnaround time or TAT or urgent, or they give it many different names. So regardless, any one of you knows what's TAT or the turnaround time? How can we define it? If anyone has any idea, you can unmute and speak or put it in the chat. From sample collection to sample processing, exactly. And where can we find it? Receipt in the laboratory collection, and the lab records log, or in the scope of service, excellent, or in the policy itself of the lab, or the lab manual. So the surveyor, when he comes and visited the labs and also the other units, the emergency department or any other ward, surgical ward or medical ward, they do ask the staff, do you have the lab manual available? Sometimes they do have it as as soft copies, so they should know how to access it. Or sometimes it's available as paper because it's very important if in case you have any downtime to make it available also for the staff. So as you said, it's the interval, the turnaround time is the interval of time between when the sample is received in the lab and the results are reported. Sometimes some others, they go into more details from the time of ordering, or they do have like a composition of the turnaround time. They started from the time of ordering until the time of collection, and from the time of collection until received in the lab, and from the time of received in the lab until the result is out. So having it in three steps, it's really important to know where is the deficit, if there is any area for improvement of that indicator, so they know, is it from the ordering until the collection, so it's related to the collection, or is it from the collection until receipt in the lab, so it's a problem that's really affecting the transportation of the sample, or is it from the receipt in the lab until the result is out? So I hope I make it clear that difference in the turnaround time. You can split it into three areas so that you can tackle where the deficit is or where is the improvement that it can be worked out by the staff. Any questions so far for the TAT? Because this is really important and it's an important indicator to follow up and to have many performance improvement project that's around it so that it can improve that indicator. I don't see any raise of hand or any keep going. Okay, good, clear, excellent. So another question that the surveyor would like to ask, what are the required steps if blood transfusion reaction is observed? The first thing that it comes to your mind is to stop the transfusion and keep the IV line open with the normal saline solution. Notify immediately the physician and the blood bank staff. Intervene for the signs and symptoms as appropriate, and monitor the patient's vital signs, and report the incidents through the QIS, Quality Information System, or through the OVR, whatever system you do have in your hospital. So this is really important, those steps to be mentioned all when asked by the surveyor. Now, when it comes to the accreditations, there are many rules or many decision rules for either the hospital will be accredited or the hospital will be offered a conditional accreditation or preliminary denial accreditation, which is pre the denial, or the last, hopefully you will not reach that, denial of accreditation. So what happens if you have the accreditation? This is an implementation of all or none. Okay, so all these should be present, a score of 85% or above. All ESR are in satisfactory compliance, and no other issues of concern related to the safety of patients, visitors, or staff. And this is usually heavily discussed during the business lunch that the surveyors will have on the first day of the accreditation. They do have the first impression about the hospital, and each of these 7 surveyors, each one from his own specialties, they will be discussing if there is any safety issues that may affect patients or staff or visitors. So these are the conditions for the accreditation if it's going to be offered fully. Other decision rules include the conditional accreditation. So the following are the rules that should be applied. Also, they should be 75% or above and less than 85% of the standards are scored satisfactory or met. And some of the essential safety requirements, the ESR, but not exceeding 25% of them, are not satisfactory compliance. So they will be given conditional acceptance or conditional accreditation. In this case, they will be offered a certain period of time during which they do need to provide a corrective action report in order to get the accreditation. And we do have a third decision rule, which is the preliminary denial of accreditation, PDA. This is a stage offered rather than the final accreditation that precedes the denial of accreditation. The aim of this stage is to give some additional time for review or appeal before the determination to deny the accreditation. So if they satisfy the conditions, they do offer the either full accreditation or conditional, or if they do not, they will be offered the denial of accreditation. So PDA would be applied if any of the following conditions in the presence of an immediate threat to safety. And again, this is fully discussed during the business lunch among the surveyors. Significant non-compliance with the accreditation standards should be significant, really affecting patient safety. Failure of timely submission of the post-survey requirements, if they do have time frame and they did not meet that time frame, or if they received a conditional accreditation and was subjected to a follow-up survey but still could not meet the requirements for the accreditation. Last, reasonable evidence exists of fraud, plagiarism, or falsified information. What's the difference between fraud or plagiarism and falsification? Plagiarism is perceived by CBAHI as the deliberate use of other healthcare facility original, not common knowledge, material without acknowledging its source, like copy and paste from other institutions. And this is really perceived by the surveyor when doing the document review. If they do have, for example, still the name of the original institution from where they copy and paste these policies and they did not acknowledge or it does not apply, they copying some services that really do not apply to their institution. So this is plagiarism. Falsification is defined as the fabrication of any information given by verbal communication or paper or electronic document provided to the CBAHI surveyor by an applicant or accredited healthcare facilities through redrafting, additions, or deletions of a document content without proper attribution. So falsifying. And again, it's really perceived by the surveyor when doing the document review. The last decision rule is the denial of accreditation. in this case, there should be a significant non-compliance with the accreditation standards at the time of the on-site survey visit, and preliminary denial of accreditation, PDA, that have not been resolved. So if they have been offered a PDA, but it was not resolved in a timely manner, so they will be under the denial of accreditation. Any questions so far? Good. So the lab standards, we do have a total 76, and substandards, they are 214. Other standards that are taken from other chapters are 110, and the total survey activities are 654 scoreable elements. So these are here. We do have the lab 654, not 53,
ما أقدر بدك
654
أروح الحضور وشي دريني
that are
على أساس تسمعين يعني لو سمعت كان بعرف.
okay. So the substandards or the lab, they include 18.2% of all the activities. The MD or the medical chapter, 640, they include 17.8% of the activities. So if you can notice that the lab is really having the highest percentage of the chapters among all the other specialties or among all the other 7 specialties. The medical, 640, which covered 17.8% of all the hospital activities. Infection control, 505 substandards, and they cover 14.1% of all the activities. Leadership, 503 substandards, they include 14% of all the activities. Nursing, 488, they accounted for 13.6%. Medication management, 422 substandards, and they include 11.8% of all the activities. And last but not least, the facility management and safety, they have 378 substandards, and they accounted for 10.5% of all the hospital visit activities. When it comes now to the activities for the lab itself, we do have the bulk percentage is spent on the document review. As I said, because if any of those document review substandards are scored not met, all other relevant activities that are staff interview, document evidence, observation, personnel file review, and closed medical record review will be scored as 0, because the main one, which is the document review, is scored 0. That's why this is really very, very important, and the surveyor will spend most of his time in the morning on the document review, and it accounted 35.7% of all the other activities. What comes next is the staff interview, because they would like to see if the staff are really knowledgeable about the information that's been present in the policy itself, if the policy have been shared reasonably and in a timely manner with the staff. So that's why it accounted for 22.4% of all the other activities. And next, it comes document evidence. It has 127 substandards, and it accounted 19.4% of those activity, because they would like to see evidence. Like, for example, if your policy, it says that you need to have your control should be run in a timely manner at every shift, and you need to run high, low, and normal control. So if this policy says that, the surveyor will be asking the staff during the unit visit or the lab section visits. They will be interviewing staff. Are you running control? Okay, show me evidence. So there should be evidence of running controls, evidence of what to do in case if the control is out of range, evidence of action, and evidence of getting it reviewed by the laboratory supervisor. So this is really very important as a document evidence. When it comes to the observation, there are 99 substandards for the observation. It accounted 15.2%. Sometimes, for example, during the visit, if there is an observation of how to donate blood, but it happens at that time that there was no person, donor, to give the blood. So this will be, for example, switched or covered by a staff interview, or like a demonstration, a fake demonstration, or like simulation done by any staff that will play the role of a donor, and simulation of donation of blood if the observation is not available or it's not possible at the time of the visit. So this will be replaced by either a staff interview or a simulation because it has to be assessed to be scored accordingly. Also, we do have 28 substandards under the personnel file review, which will cover the lab director, the section heads for the physicians covering the blood bank area, the pathology, and also any other areas there, microbiology. So these files of those people, they have to be reviewed. Also, they will request file of the newly hired staff to see if they are really doing the training at the beginning, initial training for 3 months or 6 months, and how often they do the competency assessment. It has to be all in their personnel file. So that's why the personnel file should be done in a very, very appropriate way, arranged in a very good way, so that it will be easy for the surveyor to spend efficient time while doing the personnel file review. Also, if there is a phlebotomist, so they will be having areas for, I don't know what happened. Some people, they're putting their pens or playing on the screen. Anyway, so the personnel file will include those, and also for if there is any phlebotomist, so they will be reviewing the file of that phlebotomist to ensure that really that phlebotomist get the appropriate training, the file of the POCT coordinator to ensure that they are providing training and they have been provided that POCT coordinator have been provided an appropriate training to do the training for the POCT. The closed medical record also accounted for 17 substandards, and this will be reviewing the blood administration to ensure that the order of blood administration is done by the physician. It has the donor has been consented, or also the recipient have been consented to do the blood to receive the blood. If the patient is being followed accordingly or according to the standards of the blood donation, and all of these. Also, the closed medical record review will include some charts that for the pathology, if the pathology, the anatomic pathology lab is doing appropriately the a cross section, or also if the consultation is done in an appropriate way, and all of these. Any questions so far regarding those standards and how it's been assessed? We will be going into more detail when it comes to the 2 days course, inshallah, in May. The suggested topic for the course and the laboratory standards will include many important activities and knowledge that you need to be aware of and well prepared before the survey visit. It includes laboratory customer, who are your customer, how to identify them, the operation of the scope of service of the lab. It includes also laboratory facility and safety, the laboratory role in purchasing and inventory, how to do the management of those purchase and the products that you are using in the lab, the laboratory role in the equipment management, the selection, is the lab having any role in the selection of the equipment, the control of test methods, laboratory information system, it's very important to have it as automated, and how it's really connected or tracking of those samples when the sample is received or collected until reach the lab. The point of care testing, how you monitor it, is it under the supervision of the lab? How you do the training of the staff, how you do their competency. The donor center activities, also all the relevant activities under the donor center, the vaccination, how to include or exclude some donors regarding medication, regarding vaccination. So all of these questions will be covered under that part or chapter when the course is being provided. The component processing activities for the preparation of the cross match and all of the, and also the before that, before the cross match, it's under the transfusion. For the component processing activity is how you separate the blood, and for fresh frozen cryo, RBCs, platelets, fresh frozen plasma. Also, it covers the anatomical pathology, what are really the important parts when it comes to the anatomical pathology for the frozen section, the lab roles and blood utilization and tissue review committee, the documents and the records control, how you maintain those documents, the retention of documents, retention of specimens, the non-conforming event management, the laboratory quality indicators, what are the indicators that are really specific to general lab, what are the important quality indicators for the blood utilization, the CT ratio, and if there is any other quality indicators and relevant to the tissue. And also you do have the proficiency testing, which is the external quality assessment. Also, it will be fully and in details covered in the 2-day course that will be provided in May, inshallah. So by this, I'm coming till the end of the overview. That's really an eye-opener. It's not a detailed one. It's just to open your appetite on what's going on or what will be going on in the 2 days course. I'm open for any questions if you do have any. The floor is yours.
أستاذة غوا، بصراحة بنشكر حضرتك جدا على الإيفنت النهاردة. عايزة أقولك إن عدد الحضور يعني ما شاء الله وصل لل95،
ما شاء الله.
وكلهم مهتمين بمعايير سباهي للمختبرات الطبية.
I'm glad to hear this. Inshallah, we'll
واحنا
see
احنا
your
كمان
hall.
سعداء احنا كمان سعداء بكل الحضور وبنرحب بيهم جدا. وعلشان العدد الكبير اللي حضر ده، وهدية من كواليتي ليدرز اكاديمي لكل الحضور، احنا هنديكم نبذة بسيطة دلوقتي عن كورس سباهي للمستشفيات اللي بنقدمه في كواليتي ليدرز اكاديمي. في ان شاء الله يوم 11 ابريل كورس عبارة عن جنرال اورينتيشن لمعايير سباهي للمستشفيات. بنتكلم فيه عن زيارة الاعتماد والاسينشال سيفتي ريكويرمنتس، وازاي نحضر لزيارة الاعتماد، وازاي نتعامل مع السيرفيورز، وازاي نجهز المستشفى للاعتماد. الكورس ده مدته هيكون 6 محاضرات ان شاء الله. هيبدأ يوم 11 ابريل، ينتهي يوم 2 ماي. لكل الحضور اللي حضروا النهارده ان شاء الله هيكون ليهم خصم على الورشة الجنرال اورينتيشن 10%. وهننزل لحضراتكم دلوقتي رابط جوجل فورم لتسجيل البيانات لكل اللي حابين اللي يشتركوا معانا في الورشة. بالإضافة إن أستاذة غوى مقدم إيفنت اليوم هتكون هي المحاضر في شابتر المختبرات الطبية، معايير سباهي للمختبرات الطبية. هتقوم بعمل شرح تفصيلي لكل معايير الخاصة بالمختبرات على مدار محاضرتين مدتهم 8 ساعات. هتكون إن شاء الله يوم 8 و9 مايو. لكل الحضور اللي حضروا اليوم إن شاء الله خصم مميز لحضراتكم قيمته 10%. هننزل لحضراتكم زي ما قلت لكم رابط جوجل فورم نسجل فيه البيانات عشان تحصلوا على الخصم، بشرط التسجيل في خلال 48 ساعة.
Excellent. So
ده
go on
تشجيع
and
مننا
hurry up.
لكل الحضور اللي مهتمين بالمختبرات الطبية ان هم يفهموا المعايير ويحضروها مع حضرتك شرح تفصيلي زي ما قلنا في على مدار محاضرتين مدتهم 8 ساعات. ان شاء الله في بداية شهر 5 ان شاء الله هيكون زي ما اتفقنا يوم 8 و9 مايو ان شاء الله. نزل في الشات بوكس دلوقتي رابط الجوجل فورم. اتمنى من حضراتكم كل المهتمين بالكورس سواء الجنرال اورينتيشن او الكورس التفصيلي لشرح معايير المختبرات يسجلوا في الجوجل فورم، وفريق خدمة العملاء هيتواصل مع حضراتكم وتحصلوا على الخصم إن شاء الله، بشرط إن احنا نسجل في الكورس أو في الميني كورس الخاص بتفاصيل المختبرات أو في الورشة في خلال 48 ساعة من النهاردة إن شاء الله. بالنسبة لشهادة الحضور برضو هننزل حضراتكم في الشات بوكس دلوقتي رابط البوست على لينكد ان او على فيسبوك، السوشيال ميديا المتاحة معانا. هندخل على البوست نعلق بكلمة تم، وبعد البوست بعد الايفنت مباشرة هنبعت لكل حد علق بكلمة تم رابط شهادة الحضور المجانية من على الموقع. طبعا الايفنت هيكون مسجل ومرفوع على الويب سايت، كمان الماتيريال اللي استاذة غوة شرحت منها هتكون متاحة على الويب سايت لكل الحضور. هنفتح دلوقتي باب الأسئلة، لو حد حابب إنه يسأل أي سؤال بخصوص الإيفنت. محاضرة رائعة بيشكركي. ثانك يو، محاضرة ممتعة. أنا بقرأ لحضرتك الشات. الكورس اتحدد، الكورس الجنرال اورينتيشن بدايته ان شاء الله 11 ابريل ينتهي يوم 2 مايو، والكورس الشرح التفصيلي للمختبرات ان شاء الله هيكون متاح يوم 8 و9 مايو ان شاء الله. مع أستاذة غوة هتكون هي المحاضر، وهيكون مدته 8 ساعات على محاضرتين، كل محاضرة 4 ساعات. ما ننساش نعلق على البوست على لينكد أو على الفيسبوك علشان نرسل لحضراتكم رابط تحميل شهادة الحضور المجانية من على الموقع. بذكركم تاني إن الخصم هيكون متاح لمدة 48 ساعة لكل اللي حضروا الإيفنت، هيحصلوا على خصم مميز 10% على لو حجزوا معانا الشرح التفصيلي لمعايير المختبرات أو الستاندرز الخاصة بالمختبرات. في أي استفسار عند أي حد من الحضور؟ أتمنى من كل الحضور إن شاء الله. الشرح هيكون ميكس بين العربي والإنجليزي. أنا شايفة المحاضرة مجانية، لا الكورس إن شاء الله هيكون مدفوع بخصم خاص لحضراتكم لكل الحضور اللي حضروا الإيفنت النهاردة. الشرح هيكون ميكس بين العربي والإنجليش إن شاء الله. التفاصيل حضراتكم بس سجلوا في الجوجل فورم، يا ريت تاني أستاذة شيماء ننزل جوجل فورم مرة تانية.